if you have a failing kidneys, what will happen? Now, you remember the function of our kidneys? For me to make sure that you people are getting this and are not sleeping in my class, let's do this. Mention any function of the kidney that you know in the comment section. Any function of the kidney. And if you're bright, put down the mnemonic or the acronym and tell us the meaning of that. Because some will say just, you've gotten the mnemonic, but do you know what that stands for? So for somebody who is coming in right now, they should actually learn from you who has been here from the beginning that there are functions of the kidneys. Which are they? Or what are they? Yeah? Those functions are what is important here, because when you understand those functions, you simply know that if the kidney is affected, those functions are actually affected. So the opposite is going to happen. Okay? So I want you to see this. There are major complications of a kidney disease. The chronic kidney disease. There are major functions. Yes, those who are saying a wet bed, well done. But if you're saying a wet bed, I want you to tell me what is a wet bed. Because there's somebody who just say, oh, a wet bed. Then I'm like, oh, a wet bed. What is a wet bed? You start eating your nails. You scratch your head. Mpaka kipara inakuja. So these are the complications of chronic kidney disease. And this is headed towards stage 4 and stage 5. Because, before I do this, somebody told me that those people who have a bald head, and this is not to disrespect bald-headed people, and those people who have a bald head, he said they have a lot of problems, you keep on doing this, or you don't grasp things so fast, you keep on just scratching your head, Dr. Lewis, what is the answer to this? Yeah? I will ask, which hormone is excreted or is secreted or is made by the kidneys? Which hormone? Because I've seen people talking about all these blood regulation. People have forgotten even anemia. So which hormone? There are two hormones. And do not mention hormones that are made by the adrenal gland, the one that is on top of the kidneys. No, I want two hormones that are actually made by the kidneys. Just two hormones that are made by the kidneys. Adrenaline and is in the adrenal glands. I don't want the one that is coming from the adrenal glands. I want the kidneys itself. Two hormones. Somebody mentioned renin. Perfect. Somebody mentioned renin. Awesome. So people who are talking about the RAS system understand my assignment. Now, okay, there's another one who is saying erythropoietin. Amazing. I am a good teacher. I can confirm. Erythropoietin and renin. One is regulating blood pressure, the other one is regulating blood volume, or HB, or red blood cells. But there's another hormone that's also a vitamin that is activated by the kidneys. Also name that. Which hormone is also a vitamin and is activated by the kidneys? Let us see, my bright students. Angiotensin is a protein produced by the liver. It's not produced by the kidneys. The kidneys do not produce proteins. They produce hormones. We've said renin, we've said erythropoietin. And now there's another one that is a hormone and at the same time it's a vitamin. And its final activation happens in the kidneys. And its name is actually coming in most of the supplements that you people take. And its name is cholecalciferol. Which basically means it comes from cholesterol. Cholecalciferol is vitamin D, and vitamin D comes from cholesterol, and is made when you have this UV radiation, the sun hitting your skin. It activates cholesterol into inactive vitamin D. It is then carried all the way to the liver for the primary activation, and the final activation is in the kidneys. And that's why a wet bed, D is vitamin D synthesis. So it's a vitamin and at the same time it's a hormone. That is vitamin D. So is medicine that difficult? Is it? Now that you are better doctors, let's continue. So these are the complications of chronic kidney disease. When you have a chronic kidney disease or when you're headed there, this is what you should expect. And remember, acute kidney injury or stage 1, stage 2, stage 3, A and B, they are asymptomatic. So you'll never notice it. So you'll keep on singing, oh, we will one day die. Oh, kidney disease, oh, we will one day die and all that. When you are at stage 3, A and B, even in the earliest stage of stage 4 without knowing. So at stage 4 and stage 5, that's when you start experiencing these severe symptoms and the complications. That's when you are diagnosed with a kidney disease. And at this level, we say it is either dialysis or a transplant. Stage 5, you cannot rejuvenate it. Hiyo unaacha iende, is a transplant. Stage 4, you can still work on the diets, lower the blood sugars, and the kidney start rebuilding back. Now, number 1 is metabolic acidosis. From the word acidosis, it means acids. So, remember, the kidneys are the ones that are filtering out hydrogen ions, potassium, bicarbonates, and all that, and then reabsorbing back the bicarbonates into the bloodstream. And the reason why we are reabsorbing back the bicarbonates is to neutralize the hydrogens in the blood so that you don't get an acidic pH in blood. Because hydrogen is the acidic pH, the acidity of blood. Bicarbonates is the basicity or the alkalinity of blood. So when you are told eat alkaline diets, please slap the hell out of that person who is telling you about alkaline diets, because it's the function of the kidneys to regulate acid-base balance. Even if you eat 70 cabbages and you end up getting all the, even if you eat those fruits that they tell you these are alkalizing diets or acidifying diets, you eat cabbages, you eat fruits and vegetables, you lower your blood, you raise your blood pH towards the alkalinity or the alkaline side, and then your kidney senses that and it brings back normalcy. So there is no way you will end up having an alkaline blood. The blood pH is supposed to be near neutral or even neutral. So the kidneys and the lungs are the ones that control this. So therefore it's crazy for somebody to tell you alkaline diets, oh, they will alkalize your pH in blood. What is the function of the kidneys? What is the function of the lungs? Is to maintain pH at a normal and an optimum pH so that the cells function optimally. Now, metabolic acidosis, you are excreting bicarbonates, but you are retaining hydrogen ions. As you retain hydrogen ions in the blood, that is the acidity part of it. So you're not even reabsorbing bicarbonates because your kidneys are failing. And acidosis is very dangerous because this can take you into a coma so fast in the heart attack or cardiac arrest very fast. Okay? And now, because the kidneys are failing, God was very, very perfect in his creation. So then he gave you the lungs. So the lungs come in to compensate. When you're having high acids in the blood, acidity in blood or acidosis, because the kidneys are failing, the one thing that will happen is this high or this alkaline pH or this acidic pH in blood will activate the breathing centers in the brain. And now you start breathing so fast and so shallowly. Why? Because you want to bring in the oxygen faster to help you actually maintain the status quo. And you want to excrete a lot of this carbonic acid, the weak carbonic acid that's actually causing you, you're breathing fast to excrete CO2. Because if you retain CO2, you get the weak carbonic acid, which gives you the hydrogen ions. So you breathe so fast to get oxygen so that you can actually clear the CO2 and then clear the acidity in blood. So now the kidneys are failing, the lungs are taking over. So this body, before you die, it has really done a good job. So that is one. And number 2, you see, as hydrogen is coming out, is coming into the blood, what is going to happen is this hydrogen is going to go into the cells. And as it goes into the cells, it pumps out potassium. Now, hydrogen goes inside the cell, potassium comes out because they cannot sit in the same place. Hydrogen goes in, potassium comes out. When potassium is coming out of the cell, it's coming into the bloodstream. When it's coming into the bloodstream, what is happening is you're going to have cardiac arrest because potassium is needed in very small amounts. So hyperkalemia is going to cause you heart attack and you die. And that's why they said the easiest way to kill somebody is to inject them with potassium chloride. They will get a cardiac arrest and they will die. And if you take, if you do, go ahead and do what you do the tests. There's no poison in blood. There's potassium, there's sodium. All of them are normal electrolytes. So this person died because of high potassium levels, but you cannot ascertain that this was actually the cause of death. Because these are electrolytes that are in the body. So when you have acidic pH in blood, these acids, the hydrogen ions, go into the cell and then they pump out potassium. You end up having hyperkalemia, and that is a cardiac arrest. Yes, but postmortem does not show anything. That's a cardiac arrest. Okay, so be very careful. Number 2, we have hyperkalemia. Now listen. See, we said when you're pumping sodium into the cell, hydrogen into the cell, you're pumping out potassium, right? This potassium is going to cause hyperkalemia. hyperkalemia is high potassium in blood. And this hyperkalemia is going to cause an AV block. AV block, this is for the medical students, AV block and ECG changes. And this is going to bring you cardiac arrest. So one complication is, of course, metabolic acidosis. That is going to lead to the second complication, that is hyperkalemia. And that is a problem. Now, number 3, hypovolemia. Hypervolemia. Hypervolemia means high fluid volume. So you have dysfunctional kidneys, you cannot excrete excess water and fluids, you end up accumulating a lot of fluids in your system, and this is what we call hypervolemia. When the fluids in blood are going up, the blood volume is going up, high blood pressure, rupturing of blood vessels, aneurysm, hemorrhage in the brain, that is a stroke, hemorrhagic stroke, rupturing of the kidneys even further. So hypertension is crazy, and that is caused by hypervolemia. So when you have dysfunctional kidneys, you are unable to filter the fluids, so the GFR goes down, and then sodium goes up because you are unable to excrete a lot of salt, and the water is following sodium, so you are retaining water, you are retaining sodium and then water. Your legs are swelling, your blood volume is going up, your blood pressure is going up, your blood vessels start to rupture, and all these are complications. So if this fluid is accumulating in the lungs, that is pulmonary effusion. If it's accumulating in the heart, the medical students know something that is called the jugular venous distension. And then, of course, in the heart we have that. We also have swelling legs because of edema. So I think if you see these complications, these are the weirdest complications. These are the worst, because when you get to that end, of course, there's another one that is actually more dangerous than even this other one. It's called the uremia. It's called the uremic syndrome. Now, uremia is not the same as the other one called azotemia. So look at it this way. When you have dysfunctional kidneys, you are unable to filter toxins, right? So blood, urea, and nitrogen start going up. The urea and nitrogens, not blood, the urea, nitrogens, and all the, and the creatinines and the ammonia start to build up in the blood because you're not able to get them out of the system. So when they are going up, retaining these toxins is what we call azotemia. However, when you retain them, azotemia, and then you end up getting complications of retaining these toxins. So when you get to where you're experiencing complications of retaining the toxins, that is what we call the uremia. Medical students, pharmacy students, listen to this. When you're retaining these toxins, that is azotemia. But when you start retaining these toxins and experience complications of the retained toxins, that is now uremia. So do not confuse the two. Okay? One comes in as a result of retaining the toxins, and that one comes in as a result of the complications that are actually caused by these toxins. For example, if you're retaining ammonia in the system, and then you end up having these psychotic symptoms, the hepatic encephalopathy, that is now uremia. You will see an increase in BUN. And then all the complications that are coming in, the brain is now altered, so you have these problems with the brain, the psychotic problems, okay, and altered mental states, and there are these tremors. Listen, people who have kidney problems, when you tell them to stretch their hands like this, when they stretch their hands, you see you can stretch your hands and you're comfortable. Please try that. If you just stretch your hands and you're comfortable, well done. But there's times when somebody stretches their hands and then they start shaking. The hands start they cannot stretch their hands normally. They start shaking. That is a problem. That's actually an indicator of kidney problem. And there are people who cannot do that. I know. Yeah, so now somebody is doing that. Maybe they have a nerve problem. They're wondering, could this be kidney problem? A nerve problem is also a complication of kidney disease, by the way. Just in case you didn't know. So yes. So mental problems and extended hands, they have tremors. And then in the heart, we have an inflammation of the pericardium. So pericarditis. And then effusions in the heart. And then this increasing toxins in the system can actually affect your bleeding levels. So, for example, they block the production of the factors that actually lead to coagulation. So if you have a wound, the platelets come there, they accumulate there, they start bringing these factors for coagulation, you form a mesh, and the wound starts to heal. But when you have a kidney problem, the platelet count is there, yes, but you're unable to clot blood and start healing processes for wounds. Why? Because you've blocked the ferrying of these coagulation proteins and factors towards that wound. And now bleeding becomes a serious problem. So you bleed all the time. So with those four, uremia, we have hyperkalemia, we have hypervolemia, and metabolic acidosis. The four, these are the major ones. Please hold that. Acidosis, hyperkalemia, hypervolemia, and uremia, or the uremic syndrome. This will guarantee a direct dialysis or a transplant. So when you've gotten here, wewe uko pabaya. At least for the others, like secondary hypertension, like anemia, like weak bones, low immunity, mineral deficiencies, nerve problems, edema in the legs, malnutrition, weight loss, and peripheral neuropathy, at least for those, they cannot guarantee you a dialysis. Okay, but they come in stepwise, because remember, it's a chronic kidney disease, so it's a prolonged one. It comes in slowly and progressively. So when you get to hypertension, which is secondary to kidney disease, you get to anemia, you get to mineral deficiencies, you get to low immunity, recurrent infections, you get to low vitamin D, you get to edema in the legs, malnutrition and weight loss, and you get to peripheral neuropathy, where the nerves, and you have those tingling things in your legs. That is not enough for you to get to a dialysis. That is not enough for you to avoid salt. That is not enough for you to get a transplant. However, when you move to the uremic syndrome, where your heart is now affected, your platelets count is affected, your brain is affected, and you're getting these crazy symptoms of madness. And then you have now high volume that is causing you excess blood pressure. And then you have high potassium in the system that is actually causing hyperkalemia. When you have high hydrogen ions, the acidosis. And then you have hypervolemia, high volume, high potassium, high hydrogens, metabolic acidosis. All those will guarantee you to move for dialysis, and if not, move for a transplant. And at this moment in time, when the future is so uncertain, you can imagine how expensive a dialysis is. Where I work, the county that I work in, one dialysis session takes 10,000 shillings. If you're doing 2 or 3 in a week, that is 30,000 in a week. Multiply by 4, that is 120,000. All of you know that the other day, there was a statistic that came out that 3% of Kenyans, only 3% of Kenyans have 500,000 shillings and above in their bank accounts. 3% wako na hiyo pesa kwenda juu. The rest of us are struggling from 500,000 in the bank account to 0. So which means 97% of Kenyans are under 500,000 shillings in deposits in their bank accounts. And now you have 120,000 shillings in 1 month for dialysis. And now a kidney transplant is more than half a million, 1.5 million. So if your deposit is below 500,000, where are you going to get the half a million from? Are you not going to stress people to just get you the money, and they are trying to invest? So it's crazy. It's crazy. Take care of those kidneys. They'll protect you. They don't die easily, but please take care of them. Don't feed them sugars. Don't feed them inflammatory foods. Don't lighten your skin. Change your commercial toothpaste. Don't use GMO foods. Eat salt, enjoy salt, it's good for the kidney function. Drop the sugar.